And experiences, enabling us to deepen our understanding of materiovigilance.
Yesterday, we discussed the definition of materiovigilance, the scope of medical device industry and in-market, post-market surveillance data, government initiatives on materiovigilance, internship opportunities, the role of research associates, clinicians, pharmacists, and biomedical engineers in MVPI, along with a lot of medical devices examples.
So let's begin our first scientific session of this day, that is scope and opportunities of healthcare professionals in medical device related adverse event reporting management, nurses perspective. It will be addressed by Mr. Abhilash Bandhu Kabde, nursing officer, AIMS, Mangalgiri, Andhra Pradesh. Mr. Abhilash sir has graduated in nursing from College of Nursing, Government Medical College, Nagpur. He is experienced in emergency services, ambulance services, Code Blue team, leader, trainer, and MLC procedures. He performed key role in establishing Department of Anesthesiology and OT services in AIMS Mangalgiri. He has performed key role in establishing trauma and emergency medicine treatment, and he also assisted in establishing pain relief clinic at AIMS Mangalgiri, through which numerous patients of chronic trigeminal neuralgia, chronic headaches, neuropathies, etc. are treated. So, with this brief introduction, I would like to welcome sir.
Thank you, Miss Pandey and Miss Vishala, for the warm welcome I have received here today. Good morning to all of you. Today I will be talking about nursing perspective in changing scope and opportunities of healthcare personnel in medical device adverse events reporting. Please bear with me. So, as I have got to know that you have yesterday only dealt with the definition of material vigilance, so I will be just reading it out. Material vigilance is the close monitoring of any undesirable performance or characteristics fluctuations of medical device by means of a system which is capable of identifying, collecting, reporting, and reacting to them with field safety corrective actions or device recall during post-marketing phase of medical device by IPC. This slide I have taken from IPC's Material Vigilance presentation. Then, as all of you know, we have these four modes of reporting any medical device adverse event. One is MDI reporting form, second is field safety corrective action notification form, then you have a mobile app, and you have a toll-free number. Then what will be the significance of material vigilance? Why we should be bothering about reporting or having a close eye on any material? So medical device contributes to the treatment of patient. Anything to give treatment or to measure vitals, medical devices are needed. If those things will be giving any fluctuating values, it will change. If assume some BP apparatus is giving high BP, we will be starting to give that person antihypertensives, and he may not be needing it and he may get deteriorated with it. Studies have shown that MDIs are leading to prolonged hospital stay of patient. It has increased economic burden on patients as well as the country. Material vigilance helps in avoiding substandard and incompatible devices. Then, as you must be knowing, these 23 are the uh, notified medical devices. Should I be reading them? Disposable hypodermic syringes, disposable hypodermic needles, disposable perfusion sets, substances used in vitro diagnosis, and so on. These last ones have been notified afterwards. So, why should we bother about nurses' perspective in material vigilance? What do you think is the need? Because nurses are the people who will be spending most of the time with the patient. They will be observing the patient's condition as it is deteriorating or it is improving. They will be knowing the smallest changes also. So they are the first people to be known to any deviation from anything. They will be reliable source for you to get data. So patient care, they are direct caregiver, then treatment administrator, and maximum time with patient, first to be reported to. Any patient will be reporting them only first. After that only, thing will go forward. Patient education, the education of the disease condition to the patient as well as relatives and to the medical people who won't be knowing about the disease. Then discussing treatment modalities, explaining alternatives to the patient, advocating for patient. Advocating for the patient in the sense to get the treatment changed or to get the medical device changed. Then their role in administration to manage and operate medical devices, they have to they are the key people who will be doing all the works which are related to patient and which are related to medical devices. They are the biggest user of medical devices. Key personnel to troubleshoot, they will be going through various demonstrations and all. Whenever some installation is going to happen, whenever new thing is coming, they will be always present. So they will be known how to troubleshoot. If some device is fluctuating or it is getting off, what to do, they will be knowing. Then they are key people in assisting in procurement of medical devices. So the people who are helping in procurement of any medical devices or anything, they will be known if they know that this particular company's thing has already been reported to. We won't be going for that procurement afterwards. Then to report adverse events, nursing research, to record any event, to present the case study, to collect data from various sources, to establish education program for trainees. The scope of MDI reporting, patient safety is paramount for healthcare personnel. All of the healthcare personnel, take it from laboratory to pharmacy to nursing to medical people. Everybody has their key paramount priority to be patient safety. Most of the medical devices are handled by nurses. First person to identify any deviation in outcome of a medical device. They will be doing, just assume one BP apparatus, you are one among the first notified medical device. If she is using that particular device continuously and she finds that it is giving some deviated reading, let's assume high BP it is giving, she will be the first to know it. She will be the first to report it. Use of standard guidelines in manufacturing the device, to compare and collect the data from medical devices, to avoid the devices which are being reported from other areas. Then what are the challenges of MDA reporting? What we are facing now in our place is time exhausting procedure of reporting. As you have seen that it is a big form. It takes time and they have various works, from giving treatment to taking vitals to seeing their comfort and everything. Reporting, to sit and report, it is somewhat difficult. It is a challenge. Then delay in reissuance of medical devices after recall. Just assume that I have one batch of syringes and it has been recalled due to some medical device adverse event reporting. It takes some days for me to get the syringes back. Till that time, I have to adjust with some other ward or something like that. It is a difficult thing. Confusion whether the fluctuation is MDAE or normal. Sometimes we won't be knowing that it is, we will be confused whether it is really MDAE or it is in normal range. We have to cross check it with some other equipments also. If 2 or 3 equipment are giving the consistent reading, then it must be normal. Um, lack of manpower to address the issue. As we all know, everybody is facing this issue. Hesitation to report. Many of us are like, if I go to report, somebody will report me. This person doesn't know. People don't have confidence to report also. They will be feeling very much hesitated to go in front, to come in front. They will be like, it's my 6 hours duty. I'll do my duty. I'll go home. Somebody else will be reporting. It should not be happened, but it is a challenge we are facing now. Then, as you all know, with every challenge, opportunities come. In our place, one interview happened. In that, they were calling some people who have not met with any accident on the road. As we are seeing big infrastructure of roads is coming on. So they took some interviews and 3 people they selected among them. First person they called, what is the success, what is the secret of your success? Why didn't you meet with any accident? No accident you got till now. He was like, I never met with any accident. Just one day I dashed the cow. She fell down. That's it. Nothing much than that. They sent him out. Second person came. Second person success story they asked, he was like, I also never met with any accident. Just met with one, just dashed it to a divider and some small repairs I had to do. Other than that, nothing. They sent him also out. Third person, they asked, what is the, you met with any accident? Did you dash any cow or any divider? He said, no. Did you dash any man? No. He has not met with any accidents. They were very much surprised. How can you not meet with any accident? What is the secret of your success in 25 years? He said 30 years before, when I bought my car, I didn't take it out of my garage, it's still there. I never drove it. So, as you are using medical devices and anything, you are destined to meet with some fluctuations, some deformities and something, but it should not stop you from using them or from doing your work. So we will be trying to find opportunities in all our challenges. First is to streamlining the procedure of reissuance of devices which are recalled. We should be thinking about reissuing first before taking this thing taking that particular medical device back. Then preparation of comprehensive user manual guidance for various medical devices to avoid confusion. Every medical device should be coming with user manual which will give us whole comprehensive data, like in case of troubleshoot, what we should be doing, what are the ranges which we should be expecting in it to come, manufacturer's detail and all. It should be they should be approachable to us, so that we can talk to them whether it is normal or abnormal fluctuation. Then establishment of nodal center at hospital level to report MDI. We are having pharmacovigilance nodal center at our place. For MDIs also we are trying. Organization of various awareness programs to educate on reporting of MDIs. At our place already we are being taking some classes and all, some sessions have been happening from Department of Pharmacology. They are being teaching us for Materiovigilance, and they are guiding us. Most of the times we won't be knowing, we will think that it is normal phenomenon. They will tell us that it is adverse event. Caution generation at the time of procurement of devices reported earlier. As I said, that as nurses are there in procurement committees also, if they know that this particular company or this particular device is being reported, we will be stopping that procurement to happen with that particular vendor. So the key highlights of my presentation is always be alert before opening or before starting the use of any medical device. We are always cautious to see anything, any soiling or any unsterility causing things. Observe the medical device nearby for any fluctuation, as observation is the key, we all know. By observation only we will be getting to know. As I said, the nursing officer who has been taking BP from one machine will be knowing easily if any fluctuation is coming, but the nursing officer should be observant to know that. Never hesitate to report any medical device or drug. It won't cause any harm to you. It will be beneficial for the patient as well as you. Never discard any fluctuating medical device. Always report. This thing is of very much most important. We should never be discarding such things. We should have their photos or any evidence or the thing itself with us if we can preserve it. Action can be taken on manufacturer, resulting in improved medical device flow. As you know, if we act on anything, the quality of the next things which will be coming will be good. The vendors will be knowing this institute or this department is reporting things. We should be giving them good quality things. So at our place, this some things were reported. I will be letting you know about it. This is cautery machine. It is used in operation to give incision. So it works on electricity. So while it is of our one faculty, while operating on a case of incisional hernia with proper earthings of electrosurgical cautery unit pad, sudden high joule of current of ESU pencil, this white pen like thing we will be calling it pencil. So ESU pencil resulted in burn injury on left index finger with transient paralysis of left arm and sudden onset of severe pain in left forearm. His left forearm had become numb for some time, and he has retained with a burn injury in his index finger and left side of chest. So left side of chest pain, you must be knowing it will get connected to our cardiac attacks, cardiac arrests and heart attacks, what we call. The paralysis was recovered within 15 to 30 seconds, but the pain was severe and deep seated, which stayed for half hour. Now you imagine if a doctor has started to give incision, so the patient is already anesthetized. Anesthesia time is limited. We have limited time. We cannot keep anesthesia. We cannot prolong anesthesia. So if this doctor has stayed dysfunction with this device, he cannot work for half hour. The damage to the patient's condition, you can be knowing the seriousness of the issue, you will be knowing. The ESU which we reported, the whole consignment of it has been taken back. But as I told, our challenge, it did not come back. New batch also. So another case study we had, a 56-year male patient was admitted with complaints of uneasiness and heaviness in chest in our emergency. On examination, he was having blood pressure of 170 by 100 mm, 100 mm of Hg. As you must be knowing, normal range is 120 by 80. He was having significantly more than it. So we had to give him antihypertensives. So noradrenaline was prescribed in infusion for this injection, I will be confirming it, but the injection which we have prescribed in infusion for 4 hours, the nursing officer set the infusion at 50 ml at the rate of 12.5 ml per hour, so that in 4 hours you will be getting 50 ml. So after 10 hours, when the nursing officer attached it and gone to another patient to take care of them and came back after 10 minutes, he saw that around 10 ml has already been gone. It should have been less than that. 12 ml should have gone in 1 hour, but around 10 ml has gone within 10 minutes. So it was significantly fast, but on screen, the rate was showing 12.5 only. We had around 10 syringe pumps of that same company with us. We checked all of them. Among them, 2 syringe pumps were giving such fluctuations. We reported them. They have given us repaired ones. Then a syringe. We have found one syringe. Syringes will be coming sterile in a sterile packet. In that, one hair-like structure was found. It should not be there in any of such packing. It means it is very low quality thing which we have got if you are getting hair strands in some sterile thing. So a hair structure was found inside a packed syringe as a nursing officer took it to administer the drug. It was reported to the MDI reporting center at AIIMS Mangalgiri. The syringes with the batch number were recalled by the company and no adverse event happened towards patient as it was reported before loading the drug. Case study 4. A batch of IV sets was delivering IV fluids and drugs even after stopping the roller clamp. You must have, everybody of you must have seen an IV set. In that we have a roller clamp, a button thing, which we keep, which we pull it up. It will start to drip the drug. If we pull it down, it will stop the delivery of drug. But this particular one was delivering the drug even after we are stopping it totally, and it was the problem with almost half of the IV sets in that packet. One IV set will come with 50 numbers of pack. Around half of them were like that. So it was reported to the MDI center at AIMS Mangalgiri. The batch was recalled and reported to the IPC MVPI. Then multipara monitor, you all must be knowing it gives us readings of various parameters. In one single monitor, you will be getting pulse of saturation of the patient, BP of the patient, pulse, respiration, and ECG. So it is a very important monitor in any clinical setting like ICU and emergency. It will be the only one we in emergency and ICUs we don't have time to cross check. If a machine is showing 60, we have to act like 60. We don't get time to think that it may be 120 or it may be 50. We don't get time for it. We have to treat on 60. So this monitor is really very much important for all of us. But if this only shows any fluctuations, we will see what happened in our case is was found to be showing high blood pressure of the patients. After comparing the readings with manual BP apparatus, it was confirmed. The incident was reported and the company was contacted. It was a potential MDA as it would have resulted in altered treatment of the patients. Now, some other reported things in AIMS Mangalgiri. You can see here the syringe. The syringe should be having one hub. It is not there. It was damaged thing which we have came. We have reported this too. Then in this IV set drip chamber, you can see one. Can you see one hair-like thing? That foreign particle was there in the drip chamber. We have reported it. It was just recent, 2 days before it was reported. Then in this syringe, you can see at the top, you will be getting some precipitate powder-like thing. That also we have reported. And this surgical blade, it is sterile thing. It is used to put an incision to the patient, but it was rusted. We don't know the reason of it. Sterile pack, as we opened, it was rusted. We reported it to. You imagine the quantum of the problem which we are into. We are getting so much of low quality things in our places, especially if it is a government institute, you will be easily getting such low quality things. So your work by doing this MDA and material vigilance is very much praisable. Because of you, we are getting things which are in good quality, and we have somebody to report. Then in this needle, you can see some blood kind of thing at its hub. This is also as such, it is blood or iron rust, we don't know about it. We were suspecting it is a blood clot. If such things are coming, how will we believe in that vendor or will believe in that company? We won't be taking anything from them thereafter. So this was it. I thank you all. Does anybody wish to ask any query? I thank you all. I thank you, Naiper, for giving me this opportunity.
Thank you, sir, for the wonderful session. Any questions from the audience side?
Hello. Hello. Abhilash, Dr. Abhilash.
Hello.
Yeah, I have just one question. When it comes to the nursing staff, on an average, how many adverse events are reported from your side? These type of things, like from surgical items, surgical blades, IV set, then IV cannula.
These things we have been reporting from last 2 years, sir, and as I have shown here, almost 10 equipments. More than them, we have been reporting continuously. So monthly one also, if you can say, we are almost reporting one or the two medical devices every month.
And one more question. When it comes to the government supply, okay, for example, you're working in AIMS, okay, AIMS Mangalagiri,
Sir,
and do you report it to any committees there within the hospital setting? For example, in for this one pharmaceuticals, we have with different committees like drug utilization committee, standard therapeutic guidelines committee, pharmacy therapeutics committee. Whether these adverse events goes up to any committee within the institution?
we have a pharmacovigilance unit established at our institute, sir.
Okay.
The faculty which is seeing pharmacovigilance from pharmacology department is heading material vigilance department also, and we have one uh, MDI reporting authority. I don't know her post, what her post is. Dr. Pavani, her name is. We will be reporting it to her. She will be very helpful in these matters.
This one, okay. And do you try to reach up to the company also when these type of things are reported? Sometimes this white powder, air, foreign particles, because these are very serious in nature. But it is good thing at least nursing staff they stop it at their own level. If it would have been injected to the patient or administered to the patient, it would have created a big problem. So do you try to reach up to the company also? You just report it to the
It is very good point you have raised, sir. Actually, in community, PSCs and CSCs are working there. People also won't be knowing about things. They will be easily manipulated with by giving any what to say, low quality instruments or drugs, anything. We from emergency we don't do, but we have our CFM department, community and family
family
medicine
medicine.
department. They are our two nursing officers of them are posted in two various PSCs. There, if anything of such kind happens, they will be reporting to us only. But as by my knowledge, nothing has been reported so far from their sides.
Okay. The reason is because it's a government supply. Sometimes I feel it should go to the through proper channel. It should be reported to the state
No,
regulatory
it
agency
is
as well as
being
the
reported.
companies also, so that it can be.
It is being reported. As I said, things have been recalled, so it is going through our channel.
Because at one point you said no, I really appreciate in government supply there are more chances of substandard drugs or substandard products
Sir,
because they come through the tender.
sir.
So that possibility is always more rather than the private sector.
Yes, sir.
So that is okay. I think that's all from my side.
Yeah, actually, in continuation of your statement, I would also like to know, like, has IPC also taken any step against them because such vendors should be blacklisted because it is a really a serious offense. So they should be blacklisted, and MDMC chooses its whole purpose. It's reporting it, and now action is taken against them. I think there's some regulatory person can answer better for such questions. Otherwise, you can also ask the IPC that what step have been taken against such vendors.
Yeah, I
Did your
think I
audit vigilance program ask the IPC follow?
Ma'am, whatever the reports you people have submitted to IPC, we first review it, and if we found anything suspicious, then definitely we forward it to the regulatory authority for their action. That's all at IPC we do actually. So,
Okay, because it is really
see, ma'am, suspension of
okay.
license or like canceling the order, it's the purview of the regulator sides and more often to the hospital procurement division side, ma'am. That's all.
Yes. So the regulatory authority passes that decisions to them, hospital.
I think in addition to that, what I suggest to IPC people, once they get these type of reports, they must inform to the state regulatory authorities also. You do.
Yes,
Okay. These people do, ma'am. I think that's a
yes,
welcoming, point. That's a really
yes.
good
That's
thing if
great.
they're
And
doing that, ma'am.
then in over the years, I definitely the improvement will occur
Yeah.
through such steps. Thank you so much.
But these things take some time, ma'am. So
Yes,
initially at your level, you can do like you can stop using such malfunctioning devices.
yes, yes. The hospital authorities, the particular department may be approached to stop such supply. Yes, definitely.
And one more thing I would like to say, ma'am, after during this COVID-19 pandemic period, no, when the country was in real need, many, the private firms, they came forward manufacturing all those things, and they could not maintain the quality during that process. And I think after COVID-19, we have to be more careful when it comes to
Yes.
these type of items. At least we have to make sure that
Many
they must pass through the
companies, I think, got the license to supply and everything. Yes, who
exactly.
were not serious about it. Yes,
Yeah,
yeah, true.
yeah.
Okay, I hope the situation gets good within few years. Okay, thank you so much.
Sir,
Thank you, madam.
sir, we have a question from our online audience. Ms. Shivashankar is asking whether laboratory equipments like chemistry analyzer is also included in medical devices or not.
I don't have an idea of it, but it must be there. Yes, it is.
They are. Okay.
Yes, it is.
Yes, it is actually included in the in vitro diagnostic devices.
Yes, yes.
Mr. Vivek Sharma, who
Yes.
is attending online, you can go ahead and ask your question. You can unmute yourself and ask a question.
Yes, actually, I was telling that this in vitro, it is included in the in vitro diagnostic devices regulation. What he was telling about chemistry, this clinical chemistry analyzer. So, in vitro diagnostic devices, they are also in a part of materiovigilance that I was telling.
Thank you. Thank you very much.
Thank you, sir, for the wonderful session. Now I would like to invite Dr. Samir, sir, to felicitate the speaker. Thank you, sir. Moving towards our next talk on the topic current regulatory practices for refurbished medical devices, challenges and opportunities, which will be addressed by Dr. Shatrugjay Shukla, Scientific Assistant, IPC Ghaziabad. Dr. Shukla sir is graduated from the National Institute of Pharmaceutical Education and Research, India, and received his doctorate in toxicology from the CSIR, Indian Institute of Toxicology Research, Lucknow, India. He is actively involved in medical device adverse data collation from Indian population, analysis of reports submitted at IPC, expansion of the program, and providing hand-holding support to the stakeholders. He has numerous scientific publications in internationally acclaimed peer reviewed journals and awarded in national and international conferences. He is also a trained auditor for ISO 2015 and ISO 2016 medical devices QMS. After this quick introduction, I would like to welcome you, sir.
Thank you, dear. Am I audible? Okay. So first, I would like to thank Mr. Abhilas, who has raised really some good examples why we need material vigilance. So before I discuss my present topic, I will give you some live examples or the examples we have witnessed at IPC, why we need medical device post-market surveillance. So there was a case when a person who was having chest pain went to a hospital. Doctor diagnosed him and told you have some coronary artery issues or blockage you have. So the doctor advised the patient you go for the stenting procedure. So the patient agreed and he undergone the stenting procedure. During the stunting, the cardiac stunt or drug-eluting stunt placed at the uh, uh, mm, actual site, operation went well. But when the doctor was retrieving the guide wire from the patient, the guide wire went broken. Doctor tried hard, but they couldn't retrieve the broken wire from the patient side. Okay, so the doctor shifted the patient and in a OT once again and inform the relatives of the patient that there is some problem and we are going for the open heart surgery of the patient. During the open heart surgery, the doctor retrieved the broken part of the that guide wire from the patient and uh, at that time the patient was stable. Okay, but after some time he got some complication, the urine output was reduced. So once again the doctor advised the relatives that we are putting the patient on the dialysis, and after 1 or 2 days when the patient was on the dialysis machine, he got some severe infection, sepsis infection, and at the end of the day he died. So now you imagine, because of the poor quality of the wire, a patient died, and the relatives also faced like personal loss and financial loss as well. So uh, uh, adverse events like this that I have reported to you or told you, that's why we need the medical devices post-market surveillance. It is a very important one. And the reason that Mr. Abhilas has raised that the reporting form is a 4-page reporting form. So just to update the forum, I will inform you that we have devised a 1-page reporting form that is online fillable, and it is available in both the language Hindi as well as English. So anyone of you, if you encounter any adverse event in your uh, periphery or in your knowledge, you can fill that 1-page reporting form and report to nearby center or directly to the IPC. So now, yesterday you have seen that Mr. Asim Sahu sir, he has talked about the medical device regulations. So here today I will talk about the refurbished medical devices. What are the existing regulations that are practiced worldwide? What are the challenges and opportunities in this segment? Okay, so the first thing that can come into your mind, what is the refurbishment? So refurbishment is a systematic process. This process I will detail you in the coming slides. So it's a systematic process that converts the old or used medical device to condition when it was new or even better without changing the intended use of the device. Refurbished medical device can be defined as a restored medical device rebuilt to meet the same safety and performance requirements that are comparable to its condition when the device was new without changing the intended use of the device. Refurbished equipment involve replacement of worn out parts, repair of the mechanical and electrical refurbishment, some cosmetic touch like polishing of the device or painting of the device, software updates, quality check, and testing and labeling updates, including the user manual training document. A party that maybe usually the original equipment manufacturer or any third party that refurbishes the medical devices will be subject to the same requirements of safety, quality, and the performance as manufacturer of the new medical device. As I have told you that refurbishment is a systematic process. It involves 5 steps. I'll go one by one. The first one is a selection of the used or old medical device. See, this step is a first and the foremost. It's a most important process. Not every used medical device or equipment is a fit for the refurbishment. You see, the party who is doing the refurbishment, they have to identify which instrument is best suited for the refurbishment, and when they are performing refurbishment, they have to consider the type of medical device, its history, means service record, service history, configuration, and the condition in which it was being used, and the availability of the original spare parts supplied by the original equipment manufacturer. The second step is the disassembly, packing, and shipment. The party who is performing the refurbishment, they have to make sure that during the disassembly, and no part of the medical device or equipment shouldn't get damaged. They have to pack like that, and then they have to ship the old or used medical device to the facility where refurbishment has to be performed. Now the third step is the refurbishment. When the shipped medical device is reached at the site where refurbishment has to be done, the first step is cleaning. The party has to clean medical device or disinfect the medical device before performing the refurbishment. Then whatever the required electrical and mechanical refurbishment they have to do, including some polishing, painting, cosmetic touch, system upgradability, software upgradation they have to do, and in the last they have to check for the optimal system performance of the refurbished medical device. Now the fourth step is the reinstallation. Now the refurbished product has arrived at the user site, and the party who has performed the refurbishment, they have to follow the same installation procedure as mentioned by the original equipment manufacturer. They have to reinstall the device at the use site. They have to perform or they have to show that the device is performing optimally as compared to when it was new in front of the user, and they have to submit or hand over the document like they have followed the good refurbishment practices. Compliance certificate they have to submit to the user. And the fifth step is the professional services. Professional services includes after sales services. The party who is performing the refurbishment, uh, they have to give warranty, like they have to extend 1 year or 2 year warranty of the refurbished medical devices. They have to make sure that original equipment spare parts will be available for use, or if they require, they have to like maintenance contract they have to sign, and other like user training they have to provide. So altogether these 5 steps complete the refurbishment process. Now the market, actually the global refurbished medical device market is 12.1 billion USD in 2020, and it is about to reach 21.2 billion USD in 2025 with an average annual growth rate of approximate 12%. According to reports, as of now, North America holds the largest market share of the refurbished medical equipment market, followed by Europe and the Asia Pacific region. An estimated 70% of all refurbished imaging equipments are sold in the USA and European Union alone. It is postulated that the Asia Pacific market, including India and China, they are about to witness the highest annual growth rate in the coming years as compared to Europe and USA. What are the factors that drives growth of this refurbished medical device market? You see in India and China, or even in other countries, increasing the privatization of the healthcare sector is increased. You see there are plenty of hospitals, private hospitals, nursing colleges, diagnostic centers are opening day by day. And see, they are not in a condition that they can buy each and every time a new medical device. So refurbishment of is an option for them. They can go for refurbishment of the medical device of the high-end medical equipments as and when required. And big corporate hospitals like Apollo or Yashoda or Max, they have actually a big inventory of used or old medical device. So they can't throw the used or old medical device. So they can opt for the refurbishment, and thus they can enhance the life cycle or the life of the old medical device. Even the availability of the online internet platforms can able to, means like anybody can go for refurbishment. You can just go on Google and you will find plenty of OEM like Philips and GE, Everex. They are offering the refurbishment services of the medical equipments. Growing preference for eco-friendly products. You see, refurbishment is promoting or promoting the eco-friendly products by reducing the waste of the medical device. So it is a growing trend right now. Most of the corporate hospitals or even private clinics, they are going for refurbishment. You see, in the Asia Pacific region, India and China, they have huge population. So to cater the demand of the such a huge population, this refurbishment market is growing like anything. And last is the global rise in the prevalence of acute and chronic illnesses that increase the demand of the healthcare requirement. This requirement further propel the growth in the demand of the refurbished medical devices. Now we will discuss the regulations, current regulations that are being practiced across the globe. So I'll start from the US FDA. See, US FDA doesn't define the term refurbishment or refurbished medical device. US FDA considers the refurbishment as a servicing activity. As per FDA, servicing is the repair and or preventive or routine maintenance of one or more parts in a finished device or an old device or a used device once it is distributed for the purpose of returning it to the safety and performance specification that is established by the original equipment manufacturer and to meet its original intended use. One thing that I need to mention here, that refurbishment doesn't alter the intended use of the medical device. Servicing cannot change the intended use of the device from its original purpose. Refurbished medical devices are permitted to be sold in and imported to the USA market. They are regulated in the same way as the new medical device or in vitro diagnostics is being regulated in the USA. Devices that falls under the category of class 2, they need to have 510K approval, and the devices that like including high risk devices that falls under the category of class 3 medical device, they need to have a pre-market approval before placing into the market. Now Japan, no specific definition or guidelines regarding refurbishment are available. Refurbished medical devices are regarded as a subset of the used medical device. Import and sale of refurbished medical products, including equipments, is permitted in the Japan, but there is a condition. They have to, means the party who is performing the refurbishment, they have to follow
JGMP is a Japanese good manufacturing practices and the QMS requirement, that is ISO 13485 requirements. And the refurbished medical device should be shipped from the original equipment manufacturer only. New medical devices, used medical devices, and the repair of the medical devices, they all are regulated categories in the Japan. The same requirements for the new products are applied to the used or refurbished medical devices. What are the scenario in European Union? In European Union or countries, the medical device directives and the medical device regulations do not define the refurbishment. Refurbished medical devices are regulated similarly to the new medical devices by the Medical Device Regulation 2017 by 745. Excuse me. The definition fully refurbishing used in the medical device regulations refers to the complete rebuilding of a device that is already placed into the market or put into service, or the making of a new device from used device to bring the refurbished device into conformity with the existing regulation, combined with the assignment of a new lifetime to the refurbished medical device. In European countries, no country specific regulations exist. Now in India, no clear definition or specific guidelines for the refurbishment of medical devices are available in India. And surprisingly, in Pakistan, they have a clear-cut regulation on the refurbished medical devices. But in India, as of now, there is no guidelines. The import of used critical care medical equipment for reuse in India is regulated through Hazardous and Other Waste Management, Handling and Transboundary Movement Rules 2016. Critical care medical equipments means life-saving equipments. They are banned from import and reuse under Schedule 6 of the Hazardous and Other Waste Rules 2016. And what are those banned medical devices or equipments? They include bedside monitor for ICU, ventilators, defibrillators, medical grade refrigerators, hemodialysis machine, continuous renal replacement therapies, and other like ultrasound and echo machines, bedside x-ray machine, different size of ambu mask, intra-aortic balloon pump, infusion pump. So they are banned actually in India for refurbishment or for second time use. Like, what are the other national regulations? You can see in Indonesia, Thailand and Vietnam, import of refurbished medical devices and spare parts is completely banned. In some Eastern Mediterranean countries like Egypt and Morocco, import and sale of used or second-hand and refurbished medical devices is also banned. There, the manufacturer or importer, they have to present an original certificate indicating the manufacturing year of medical device, and that shows that this is new device or it is safe to use. In some Latin American countries like Venezuela, Peru and Ecuador, import of refurbished medical device is allowed only in the private settings. However, in Argentina, Brazil and Uruguay, imports of refurbished medical devices are allowed, but there is but subject to technical assessment certificate or technical documentation, respective ministerial approval and selective conditions. In countries such as Kenya, Philippines, Republic of Korea, Sudan and Singapore, no specific guideline for refurbishment of medical devices exist. However, import of refurbished or reprocessed medical devices subject to the fulfillment of registration requirement and the quality testing. Very recently, Malaysia has come up with a regulation over the refurbished medical device. They have clearly defined what is the refurbishment and what is the refurbished medical device that comes under the regulation. How use of refurbished medical device can help us. You see, refurbishment is like you are giving a new life to an old machine or an old equipment. Supports the sustainable healthcare system. It supports the sustainability of a system like a healthcare system. The option of refurbishment maximizes the value of medical device. If you are going for the refurbishment, you are giving a new life to an old machine or an old equipment or an old medical device. So it enhances the value of your investment as well as of medical device. Refurbishment reduces the waste and thus contributes to a circular economy. Refurbishment saves the energy as well as the resources, manpower as well as financial resources. It saves. The opportunity to upgrade to the newest technology is possible and can be grabbed with ease. You see, at present, technology is changing in a such a speed, like today you are using some phone, and tomorrow when you will be awake in the morning, there will be a launching of a new phone. So technology, with the help of like refurbishment, you can go and upgrade your phone or upgrade your similarly upgrade your medical device or equipment with the refurbishment. What are the challenges in this segment? Many people still think that pre-owned products or refurbished products, they are of inferior quality, and hence they refrain or they avoid buying the refurbished products. The sector is still unorganized, allowing companies that do substandard refurbishing to charge less for the refurbished equipment than their organized counterpart. Organized counterpart include the original equipment manufacturer, companies like GE and Philips and Everex and Core. They are offering the original. Actually, they are the original equipment manufacturer, and they are providing the refurbishment services. No after sales service is the biggest one of the biggest challenge in the sector. This shortcomings adds to the cost of refurbished medical device by roughly half of the total cost of the refurbished product. And dominance of the major MNCs, as I've told you earlier, GE, Siemens, Philips, Everex in the market. So no much space for the domestic companies. What are the opportunities? Excuse me. The market for the refurbished medical equipment is growing in the low and middle income countries, including India. Companies, the domestic companies or MNCs can seize this opportunity and increase their market share. The small town and the rural market are still untapped in the Asia Pacific region and as well as in African region. Growing preference for eco-friendly products, and companies can collaborate with the state and central governments to support the refurbishment process. So here's my team at IPC. Thank you. If any of you have any question about this topic or material vigilance, you can ask. Thank you.
Thank you, sir. I'm very grateful for your excellent session. The session is open for question and answer. You may.
Thank you, sir. Thank you for your wonderful presentation. Uh, it's completely changed my perspective regarding refurbished device. I used to think that that is quality is associated with the refurbished product. But my question is not related to refurbished product. My question is related to material vigilance. So my first question is, who is the right person to do the causality assessment of MDA?
See, as per SOPs, when you are filling that application form for participating in the MVPI, then there is a clause that you have to establish a causality assessment committee at your center. So the committee that includes senior doctors and person from the procurement division, person from the nursing part, person from the pharmacist side or biomedical engineer side, altogether they constitute a medical device, causality assessment committee. So they are the right person to establish causality. And in case if you don't have that such committee, then you can report us. We have a causality expert group with us, so we decide the causality.
So is there any scale regarding the causality assessment that is accessible to us?
See, no internationally accepted scale is as of now there. See, but European guidelines or directives, they have a scale similar to PVPI.
We don't have any scale.
So, but no clear cut or internationally accepted scale is there.
Okay. Then next question is, what is your opinion regarding how to enhance the reporting of MDAME at institute level?
Pardon?
What is your opinion regarding how to enhance the MDMA reporting at institute level?
What I think is the first and the foremost requirement is the awareness.
Awareness.
Even the government is pushing us. You have to empower the consumer. In future, we are not going to give you associates or the manpower. We have to strengthen you people. Once you all are aware that yes, there is a process, yes, there is a system where you can report or uh, like submit the whatever you are suspecting that this is because of some drug or this is because of some device, so you can report us. You can report to our means your nearby center. Suppose you are here, you can report to AIMS Patna or Naipur Hajipur. They will reach us, they will forward your findings to us, and we will review it, and whatever requirement or whatever the things needed, we will do.
My last question is, it's not related to pharmacovigilance. I mean, not relevant to this topic, presentation topic, but what are the scope and opportunities uh, regarding this research?
Research, okay. So
What research work can be done related
yes,
to
yes, sir.
pharmacovigilance?
I'll explain you. See, there are two perspectives. One is the uh, prospective research you can do, and one is the retrospective. Like you, suppose you go to AIMS Patna and want to have some research on the cardiac stunts, so you can go retrospectively. Like you can study and review what are the past experience they have, like when they were performing uh, cardiac surgeries, they have used cardiac stunt. So so you can check whether there was any adverse event was there or not. So in this way, like retrospective, and you can also go for prospective approach. Okay, so you can since today, suppose you joined today, and so since today for upcoming 1 year or 2 year, you can study whatever they are doing, and you can find if there is any adverse event with any patient or with a device, you can study. Similarly, the what is your interest? Like there are plenty of medical devices are there. You have interest in the cardiology, in the orthopedics, in the neurobiology. So you can choose any medical device that falls in particular domain and do your research. Uh, just to update the forum, IPC on IPC website, you can go and find a rolling advertisement is there for the internship. Okay, so anybody who is interested in doing research in PVPI or in MVPI, whatever, you can fill that form, and we will try to place you in the nearby place from where you belong. It's like suppose you are from Hajipur, so we will try to put you in the Naipur Hajipur or in the AIMS Patna. Even if you are willing to relocate, we will help you. If you want to do your research at NCC or headquarters, we will support you.
Okay, thank you, sir.
Sir, we have some questions from our online attendees. In
Yes.
case of any foreign particles found in packages of IVDs, do you seek CAPA from vendor, manufacturer, or suppliers, corrective and preventive actions? In case of any foreign particles found in packages of IVDs, do you seek corrective and preventive actions from the vendor, manufacturer, or suppliers?
See, I have just what is the prevalence and impact of adverse event specifically related to this question I need to answer?
Yes, sir.
Okay,
I have one question.
please.
Uh, how the cost of these reprocessed devices are regulated in India?
See,
Because if the suppose the pacemaker is original cost is 1 lakh, reprocessed, some hospital may be charging 50,000, some may be charging 75,000. So how one can decide?
sir, actually, as of now, when there is no regulation on the refurbished medical device, so how can we think that the price will be regulated? So as of now, no regulation is there in India.
Uh,
But,
th-
uh, but you
that
can refer to original equipment manufacturer. Suppose your device is from Philips or from GE or from Siemens, so you can contact directly to them. Don't go for the domestic refurbishment provider, because right now they are offering low class refurbishment service.
But as you told that these devices cost less as compared to the original price, right?
I
So
told you that the refurbishment cost less when compared to buying a new medical device or equipment.
yeah, yeah.
Hmm.
So, but then we can't say that two hospitals are charging same thing, same cost for the same device, like pacemaker.
Mhm.
That is the
Hospitals.
thing. Yeah, if one is putting the one in Apollo and another in the Max, right? Repurposed device.
So
So,
hospitals. So you mean to say that hospitals
any
are?
guidelines, any guidelines for that regulations of the cost?
Sir, I told you that in
Eh,
India there is no guidelines on the
uh,
refurbishment or refurbished medical devices.
yes.
This is a actually untapped sector. This is the budding area. So I just want to update this audience about yes, this is also a sector apart from the existing medical device or MVPI.
Okay, thank you.
Okay, I think this question was for Mr. Abilas. Abilas, here is a question for you. In case of any particle found in the packages of IVDs, do you seek kappa from the vendor, manufacturer, or supplier? So you can use mic. Actually, it's an online question for you.
Hello. We as a nurses won't be seeing directly any corrective actions from the vendors. We will be reporting it to the MBPI center in our aims, and they only will be seeing the further procedure, including recalling and every other corrective actions. It is seeing by them only.
Okay. So one more question that I can see right now. One person, Ritik Goswami. I am a student of MPharm first year pharmacology. My query is like nowadays. I think it's perfect. My thesis in second year. Yes, Ritik, you can opt for your 1 year project in the MVPI segment. You talk to your supervisor, and with the consent of your supervisor, you can contact us. We will definitely help you. So, thank you very much to all of you.
Thank you, everyone. Now, I would like to call upon Dr. Krishnamurthy sir as well as Mandal sir to felicitate our guest. Now it's time for tea break. I would like to request you all to have a mini refreshment and we'll resume after 10 minutes. Thank you.
cannot remember.
The session will be delivered by Dr. Manish Kumar, Additional Professor, Indira Gandhi Institute of Medical Sciences, Patna. Dr. Manish Kumar sir have done his MBBS from Mahatma Gandhi Memorial Medical College, Jamshedpur, Jharkhand, and did his post-graduation MD Pharmacology from Patna Medical College and Hospital, Patna. He have the expertise hypertension, tropical diseases, pharmacovigilance, and medicinal plants. He has published 40 original research articles in peer reviewed international journals and reviewed 25 research papers for publication. He has worked as co guides in around 4 MD pharmacology, 2 DM clinical pharmacology, and 3 PhD pharmacology dissertations. He is a member of National Editorial Board of the IP International Journal of Comprehensive and Advanced Pharmacology. I would like to call upon Sir to take over the session.
Thank you for introducing me. I am also grateful to Naipar Hajipur and IPC Ghaziabad for giving me this opportunity to present this lecture on medical device adverse event monitoring in hospitals, current practice and trend analysis. In this 2-day national um, program on material vigilance, training program material vigilance. So, in this presentation, following topics will be covered by me. First and most important topic is what are medical device adverse events, MDAE, and why they are important to monitor. This topic has been covered by and discussed by most of the learned speakers in this national program, but I will give some overview of it. Second topic will be current practice of medical device adverse event monitoring in India and Bihar. What are the current practice in India, all over India, different medical monitoring centers as well as in Bihar. Third, we will analyze the trend of medical device adverse event reporting both in India and Bihar. Fourth, most important, also another important topic, different factors, issues, challenges which contribute the reporting of MDAE. So there are different factors. So this topic is also covered and extensively discussed by different speakers, but I will give some overview only. And then we will see the best practices for medical device adverse event reporting and monitoring. What will be the we have what the practice we can give or do to increase the reporting and monitoring. So every day, newer technology and newer medical devices are introduced in the healthcare system, and whole healthcare system is entirely dependent or relying on the medical devices, either for palliation, prevention, diagnosis, or treatment. So these medical devices are boon for this healthcare system, but they carry some level of certain level of risk, and this risk may be either minor or major, and these risks are called medical device adverse events. And these medical device adverse events can be minimized or checked with the help of active reporting, active monitoring, and dedicated this type of seminars or workshop to train the healthcare professionals and biomedical engineers also. So the monitoring and reporting is crucial for this. So I am giving some overview of medical device what are medical device adverse events. Any incidents or malfunction that occurs during the use of a medical device which can result in harm to the patient. This ranges from minor injuries to serious complications, and it occurs due to variety of reasons like design flaws of medical device, manufacturing defects, or improper use by healthcare professionals. Why MDA monitoring and reporting is important? It helps in identifying potential safety issues, and it improves patient outcomes. Also, healthcare professionals can identify patterns and trends of adverse events related to medical device, and it helps them to take decision on this device selection, training, and usage. Once the any medical device has been any report has been given to any medical device, healthcare professionals get education about the defect or issues with the medical device, so they can take decision on device selection, training, and usage. Additionally, reporting adverse events is mandatory in many countries, including India. But according to Dr. Satrunjay Shukla, there is no regulation or guidelines for refurbished medical devices. Now, current practice of MDAEM in India. MDAEM in India is regulated by CDSCO, which requires hospitals to report any adverse events related to medical device. But the hospital often lack the resources and expertise to properly monitor and report adverse events. This leads to underreporting and incomplete data. Also, there is lack of standardization in reporting requirements across different states, which make it difficult to compare data and identify trends. Despite all these challenges, all the medical device monitoring centers are giving their sincere efforts to improve medical device adverse event monitoring in India. Also, to improve patient safety on regular basis, IPC is providing awareness and sensitization program to healthcare professionals about importance of adverse event monitoring and also training for proper reporting procedures. What is the current practice of MDAEM in Bihar? In Bihar, MDAEM is still in its nascent stages. There are no specific regulations or reporting requirements for hospital to follow, which means there is no standardized approach to monitoring and reporting related to medical devices. But some of the medical device monitoring centers of Bihar have started taking steps towards monitoring and reporting adverse event. In this regard, NIPER Hajipur is leading in terms of reporting in Bihar. Challenges like lack of awareness among healthcare professionals, limited resources, and inadequate training about how to report adverse events are the challenges we are facing in um, centers of Bihar. Now, trend analysis of medical device adverse events in India. What is the trend? Over the past 8 years, since the launch of MBPI at IPC Ghaziabad by DCGI, which is launched on 6th July 2015, under national regulation of CDSCO, there has been a steady increase in the number of reported medical device adverse events in India. In 2015 to 2017 year, only 350 medical devices were reported, adverse events of medical devices were reported, while in 2022, the number of reporting has increased over 5,600. So, majority of these adverse events were related to cardiac stents, catheters, heart valves, intrauterine devices, orthopedic implants, syringes, IV cannula, infusion set, infusion pump, ventilator, diagnostic equipments like ultrasound. Also, there is a significant increase in number of adverse events related to mobile health applications and wearable devices also. So, this trend highlights the need for improved monitoring and regulation of this emerging technology also. Trend analysis of medical device adverse event in Bihar. First, medical device monitoring center of Bihar was established in Naipar, in AIMS Patna, AIMS Patna, and then Naipar and IGMS Patna. So from 2020 onwards, since the starting of first MDMC in Bihar, there was a steady rise in reporting with sharp spike seen from late 2022. And this has been possible by this type of training program and awareness to healthcare professionals. So further analysis shows that the majority of adverse events were caused by human error in case of Bihar, such as incorrect use, incorrect maintenance of medical device. Also, some of the cases were due to faulty or malfunctioning of medical devices. So these findings highlight the importance of proper training, education for healthcare professionals, as well as the need for regular maintenance and quality control checks on medical devices. In this slide, you can see the graphical representation of number of reportings from all over India, medical device monitoring centers of all over India. I have taken from November 2021 because our center has been established in 2021 and we have data from November 2021. So there is a steady rise in, you can see the steady rise in reporting of medical devices, both all over India as well as in Bihar. And you can see the spike in this reporting, number of reporting is seen evident after October 2022, just because of active work by IPC Ghaziabad, Materiovigilance program of IPC Ghaziabad. In this slide, you can see the top 10 medical device monitoring centers. Performance of top 10 medical device monitoring centers on the basis of reporting from year 2021 till date. Most of the reports has been given by PGI Chandigarh and then Lady Hardinge Medical College, New Delhi, AIMS Rishikesh, AIMS Bhopal, KMC Manipal, NIMHANS, AIMS Bhubaneswar, JSS Medical College, Karnataka, Naipar Hajipur, and Royal Care Super Speciality Hospital, Tamil Nadu. From year 2021 till date, 176 cases has been reported by NIPER Hajipur and 8 cases has been reported by AIMS Patna. Now, different factors or issues or challenges which affect reporting of medical device adverse effect. Uh, I have divided these challenges in three parts. First, issues at the level of healthcare professionals and biomedical engineers. Issues at the level of organization or institute. And third one, issues at the level of medical device manufacturers, importers, or traders. At the level of healthcare professionals and biomedical engineer, most important issue is lack of knowledge and training. Most of the biomedical engineer and healthcare professionals do not know who to contact, do not know how to report, and they poorly or unable to recognize medical device errors. They also believe that the event will not occur again. Most of the healthcare professionals believe that once this event has been occurred, it will not occur again. They believe that reporting will be ineffective and not bring a positive change. So they have negative thoughts. Also, medical device malfunctions are not considered as patient-related adverse events. As in pharmacovigilance, any adverse event due to drug is related to patient healthcare system, patient related. But most of the healthcare professionals do not consider this medical device adverse events as a patient related adverse event. And most important challenge is workload, lack of available time and time limitations of healthcare professionals because they have shift duties and they have surgery to perform and others. And fourth one is complicated system of reporting. Some of the health professionals also say that the reporting is very complicated. We have to write various things and we have to consult to biomedical engineer or store officer. Now, the different factors or challenges at the level of organization or institute. Organization, when healthcare professional or biomedical engineer report any adverse event of medical device to organization or hospital, they unable to recognize the importance of reporting. They do not give importance to this reporting. Also, they worry about consequences of reporting. They must think that the reporting will give a negative impact on their hospital and other. Also, their equipment, some of the equipments is used beyond its end of life cycle due to inability to replace them. As Dr. Satyendra Shukla has delivered that the refurbished instruments are used. Also, refurbished instruments which are will be taken from good manufacturer, but some of the hospitals are using instruments beyond its end of life cycle. Also, they are not standardizing the acceptable level of error. Any medical device, they have to standardize the acceptable level of error. Also, there is lack of feedback from manufacturers about malfunction device and lack of maintenance contracts also can result in adverse event. Now, factors or challenges at the level of manufacturer, importer, and traders. They lack responsibility of reporting. Most of the manufacturer will say that I will replace the instrument, I will make some arrangements, but they will not report. Also, their staffs and technical staffs have limited knowledge on new devices and their complications. They have fear of negative opinion on device manufacturers. Also, they poorly recognize association between medical device malfunction and patient outcome. And quality of medical device adverse event information they receive is variable and most often poor. Sometimes the healthcare professional has reported this medical device is faulty or it has some issue to manufacturer. But the quality of report is to manufacturer. The quality of report which received by manufacturer is either variable and most often poor. In this condition, manufacturer is unable to perform other things. Very often the malfunctioning device is not returned to the manufacturers for assessment. Now, what are the best practices for medical device adverse event monitoring? One of the key best practices for medical device adverse event monitoring is to establish a clear reporting system. And also important to ensure that all reports are thoroughly documented, including details such as which type of device involved, what is the patient's condition, and any actions taken by healthcare professionals. Another practice is to promote effective communication among healthcare professionals. It is most important. Additionally, it is important for healthcare professionals to stay up to date on the latest regulations and guidelines related to medical device adverse event monitoring and to continuously evaluate and improve their current practices. It is very important. Now, conclusion of this presentation. Medical device adverse event monitoring is crucial for ensuring patient safety. Healthcare professionals are facing many challenges, but this trend analysis, which has been shown by me in previous slides, there is potential for improvement in reporting. And we have to identify the challenges or issues or contributing factors which can help in improvement of reporting. To improve reporting, it is important to follow best practices for reporting, documentation, communicating among healthcare professionals. Also, it is recommended to establish a standardized reporting system. And most important recommendation is to increase training and education so that the healthcare professionals can become more knowledgeable about adverse event monitoring and improve patient safety. These are the references. Thank you. So, any questions?
Thank you, sir, for the remarkable words. Now the session is open for question and answers.
Hello, sir. It was informative. So, one more big question is how to report, sir.
How to? Yes.
So, ma'am, I answered your question actually. After this presentation, my colleague, Ms. Nikita Misra, will be presenting the tools and techniques on how you can report, what to report, where to report. So, kindly be with the sessions. So, she will update you about how to report.
Okay, thank you, sir.
Hello. Hello. Vivek Prajapati, you have raised the hand now. You can unmute yourself.
Okay. Thank you for
Hello.
Naipa Hajipur.
I
Yes,
have one
I
question.
just.
It actually related to which type of events we can actually call the medical devices adverse event. Because in earlier presentation from Kadbe sir, he has mentioned that some of the errors like case 5 and case 6, I think, in that syringe it has broken up, and another case in that saline it has the foreign body. So in this case, actually, the event was not there. Before happening of that event only, it was reported. So it is possible that we can include those instances in the adverse event.
No, see, in this case where the patient is not involved, such incidences are called near-miss incidents, and you can report.
We can
Yes,
classify into near miss.
you can report.
Put it as a medical adverse event.
Yes, you can report, and it is considered as a MDAE. And see, even if you are suspecting that this adverse event or undesirable outcome is because of this device, just you have a suspicion, even that you can report, and establishment of causality is subject to investigation. And if your center has some expert committee, then you can decide. Otherwise, IPC can do it on your behalf. Thank you.
So we can report those.
Yes, obviously you can.
Thank you.
Okay.
Thank you, sir. Now I would like to call upon Dr. Krishnamurthy, sir, to felicitate the speaker.
Online question is also there.
Which question? What happens after it was found that AE was related to device instability? Still compensation is
See, I can read one comment from Mr. Shiv Prakash. So he's asking if any device is found to be related with the medical device adverse events, then will compensation be paid to the patients? See, Mr. Shiv Prakash, it is not under the purview of IPC. It is at the regulator side. So if they found, and if they like whatever the recommendation we are giving to them, based on the recommendation forwarded from IPC, they will decide. So it is entirely up to them.
So thank you. Thank you, sir. Thank you.
Thank you, sir. Now I would like to call upon Dr. Krishnamurthy, sir, to felicitate the speaker. Moving towards our next session, that is medical device adverse event reporting tools and uses addresses. Now this is addressed by Ms. Nikita Mishra, Materiovigilance Associate, MVPI IPC Ghaziabad. Ms. Nikita Mishra ma'am is graduation in biomedical engineering from Buldelkhand University, Jhansi. She has more than 6 years of multitude experience in the field of medical device maintenance, management, and post-marketing surveillance. She is responsible to ensure the safety and efficacy of medical devices in India to promote the post-marketing surveillance of medical devices. She is also responsible to organize national and international workshops, seminars, and training programs in order to strengthen the material vigilance program. She is actively involved in designing monthly e-newsletter, guidance documents, reference manuals, training modules, SOPs, etc. and development of monographs for medical devices in order to keep the stakeholders updated on the activities related to MVPI. She is also providing project based guidance to all the research scholars and project trainees under MVPI. With this brief introduction, I would like to invite you onto the stage, ma'am.
Thank you for the kind introduction. So in this session, we'll be discussing about the reporting tools. What are the reporting tools MVPI is having to report medical device adverse event? So before moving towards the tools, first we discuss about the difference between drug and medical device. So basically, drug is based on chemistry and pharmacology, while devices are based on engineering principles. For drug and devices, both cases safety and efficacy is important. But if we talk about the drug, safety and efficacy is important. But in device, safety and performance and accuracy of the device is important. Why accuracy is important? There are number of devices like BP operators, pulse oximeters, patient monitors in which accurate reading is important. Thermometers. So in these devices, accuracy is more important. Drug based on the clinical trials like 4 trials, phase 1, phase 2, phase 3, phase 4, while devices is having the clinical evaluations. In devices, quality management system is important. But while if we compare device to the drug, good manufacturing practice is important. Local and systemic toxicity is important in case of drug, while in device, biocompatibility of medical device is important. In drug, long product life cycle is there, while devices short product life cycle is there. If we talk about the devices, like for example, if we take X-ray machine, the X-ray machine which we are using 10 years back, it is not same. Like the technology, if is updated, size of the device is reduced, complexity of the device is reduced, and in device malfunctions is there, but in case of drugs, drug interactions are there. So this slide is all about the need of Materiovigilance. Why this program is important? There are a number of examples. Satundar sir has also explained the examples of how cardiac stent is causing adverse event to the patient and it leads to the death of the patient. So there are a number of adverse event that is leading to the death of the patients. Like in the newspaper clippings you have seen that MRI machine killed a man in Mumbai. So these are the real examples, and it is also published in the newspaper headlines. So we have clipped for you. In queue of COVID-19 pandemic also, there are pulse oximeter which is causing the inaccurate reading. Thermometers also causing the inaccurate reading. And in case of COVID-19, like antigen rapid diagnostic kits are there, which is also causing the false positive and false negative result. And this examples also will discuss in the case study in the later slides. So, so, so to prevent the patient, to save the life of the patient, the reporting of medical device adverse event is important. So on the basis of risk, medical devices are categorized into 4 categories as per Medical Device Rules 2017. Risk depends upon 2 factors: level of invasiveness of medical device or duration of use of medical device. On that basis, medical devices are categorized into 4 categories. What are the 4 categories? Class A, that imposes low risk to the patient. For examples, thermometers, surgical swabs, these are the examples of devices that are causing low risk to the patient, or they are imposing low risk to the patient. Class B imposes low to moderate risk to the patient. For examples, BP apparatus, suction equipment, hematology reagents. Class C imposes moderate to high risk to the patient. For examples, devices, MRI, X-ray, PET-CT, ventilators, these are the devices comes under this category. Class D imposes high risk to the patient. Mostly all the implantable medical devices comes under this category. Cardiac stents, defibrillators, pacemakers, all the devices comes under this category. How you categorize implantable devices? How you identify among all the medical devices which device comes under the category of implantable or else non-implantable? I'll just giving you the definition. If a device stays inside the patient body for at least 30 days, then the device comes under the category of implantable as non-implantable. Now you can easily to identify. So now we discuss about the modalities. What are the tools we are having to report such adverse event? First is we are having the medical device adverse event reporting form. That is the form. It is available on the IPC website. It is editable in nature and you can easily download this form from the website and it is easy to fill. Second is field safety corrective action reporting form. This form is not for the healthcare professional. This is for the MAH, medical device stakeholders. This form is designed to notify regulatory authority regarding the corrective action or any product recall of medical devices that has been initiated by the manufacturer in order to reduce the SAE at the market. Clear? Third is we are having the mobile application which you can easily download from the Google Play Store, and this application is same for to report drug or medical device. Fourth, we are having the toll-free helpline number, that is 1800-180-3024. That is available Monday to Friday 9 to 5:30. IPC team helpline team is there at IPC on behalf of the reporter. They'll fill accordingly. So these are the tools we are having. So now in MVPI, major reporting we are receiving from the form, medical device adverse event form. Though we are receiving reports from the toll-free helpline number and mobile application. Now we discuss about the reporting form, and we discuss all the section by section. We'll discuss this form. So this is the dummy copy of reporting form. And this form is divided into 9 sections: general information, reporter details, device category, device details, event description, patient information, history and outcome, healthcare facility information, causality assessment, MS investigation and action taken. So one section by section we'll go and discuss the points. What are the sections are there in general information? In the first section, general information, that is date of report is there, on which date you are reporting or on which date you are notifying this report to the MVPI or any regional training center. Type of report, if you are filling the report first time and you are not having much details about the case, we'll just take the initial. In addition, you are providing additional information on the same case, you'll just take the follow-up. Clear? Third, we are having the final. If you are having a case, you are having all the complete information, we'll just take the final option. If a device is causing, if same device is causing multiple adverse event or same adverse event, we'll just take the, and the frequency is more, we'll just take the trend option. Clear? This is second section is all about the reporter details, type of reporter, whether the reporter is manufacturer, importer, distributor, healthcare professional or patient. If it is not the healthcare professionals, importer, distributor, they'll just tick the others and then specify. In case where the reporter is not manufacturer, they has to inform that reporter has informed this incident to the manufacturer or not, just tick yes or no. Clear? Is the reporter also submitting the report on behalf of reporter or on behalf of manufacturer? Just tick yes or no. Reporter contact details, in which we require name, address, telephone number and email address. Why this reporter information we require? Because in case if we take any additional information on the case, we'll just contact to the reporter. And their duty is to submit, like to collect those reports and submit to the MVPI, Material Vigilance Program. Next. Third section is about the device category: medical device, in vitro diagnostic and medical equipment. Medical device is a broad category that is like an umbrella, while IVD and medical equipment is a specific categories. IVDs, for example, is pregnancy kit, HIV kit, COVID-19 antigen rapid kit. So According to your device, you'll just tick. Medical equipment, that the devices that requires certain calibration, preventive maintenance, installations, expiration dates, they require. So, for example, X-ray, MRI, PET, CT, patient monitors, defibrillators, these are the devices. So, in device details section, you just write the name of medical device, brand of the medical device, manufacturer name, address, importer, distributor's name and address. In device detail, is a device notified regulated in India. So all in India, all the medical devices are regulated. So you just tick yes. License number, catalog number, lot number, batch number, according to your case, according to your medical device, you can whichever section is applicable for you. Like in case of thermometers, installation date will not be valid, like implantation date, it is not applicable for that. So according to your medical device, you'll just fill all the details. And this details, if you are not having or if you don't know how we can get this information in a hospital, you'll just go, you'll just ask the biomedical team, biomedical engineers, they'll give you all the details regarding the device, because they are having the device details. Or from your end also, you at the back of medical device, all the details are there, you can easily identify and fit. So event description section, date of event is there. Where the case is near miss incident, you just give the date of near miss incident, or if the incident has happened, then just give the date of event, date of implant, explant, location of event, whether it is hospital, whether it is manufacturer, distributor, premise or home. There are devices we are also using at home, so you can tick accordingly to your device. Device disposition, current location of the device, whether it is remains implanted in patient or within the healthcare facility at home, or it is destroyed, or if any other case also, you just specify. Is serious adverse event that is lead to the life threatening, congenital anomally, prolonged hospitalization of the patient, and any other serious intervention, surgical intervention required, then you just stick according to your device. If it is non-serious in nature, then you will take the non-serious. So in detailed description of event, from starting what has happened to the patient, from diagnosis, treatment, any imaging cases are there, any imaging details are there. Along with the case, you can also you can attach diagnostic report, X-ray reports, MRI reports, any report it is applicable, then you also send. So all the details, date of implant to explant date, everything is covered in the event details section. So this section is not for the healthcare professional. This is for the manufacturer, where they can fill past 3 years national as well as international data of supply. If they encounter any adverse event past 3 years, they can also fill all the details. So in this section, patient information, history and outcome, it is related to the patient. At IPC, we do not ask patient to fill all the details. Like you can only give the patient initials to us. So at IPC, we are also maintaining the confidentiality of the patient. We do not share any patient information to the third party. So patient hospital ID is, we require patient initial, age, weight, gender, or any other past history of the patient, relevant history of the patient we required. Why we require these data? So this helps us or our experts to obtain the causality of that case. Because in some cases we do require the past history of the patient. Patient outcome, recovered date, not yet recovered. If it is death, then you just mention the death date of the patient. And if in case others is there, then we'll just specify what has happened to the patient. So this session is all about the healthcare facility information. We require name, address, contact person name and telephone number of the healthcare facility. So this section is for the causality assessment. Those hospitals or MDMC, they are having the causality assessment team, so they can mention whether it is related, not related, likely, possible, probable. 5 skills we are working in medical devices. And sir has also explained that for medical devices we are following the European guidelines or directives. According to the European guidelines, we fill like whether it is related, not related, probable, possible, and unlikely. So this is related to the manufacturer authorized representative investigation and action taken. If the device is written to the manufacturer, what action they have taken, any corrective or preventive action they have taken or not, they'll write all the details. If any device history, like past history of the device, if the device we have received this time, if the device is having already reported in the past, the manufacturer will check in the database whether we have these cases previously also reported or not. So all the history he has to give in the device history review. So this form is an English version we have discussed, but this form is also available in Hindi language also. So this is a dummy copy of Hindi version of MD reporting form. Sections are same, but it is only converted to Hindi language. This is the one-page reporting form MVPA has developed in queue of COVID-19 pandemic. And if you encounter any adverse event related to the personal protective equipment, that is gloves, coverall, mask, and 95 mask, you can report via PPE reporting form that is specifically designed in COVID-19. And this is the reporting form we designed for the consumers. This is one-page form only. So whatever the consumer can easily fill this form and send to the MVPI program. So this is the MVPI is also developing the indigenous software to report medical device adverse event. This ADRMS software is in pilot mode. Once it is available to the forum, so we'll give all the details to you. We'll share the link also, and you can register. You can directly also register as a consumer, or you can register as a regional training center of NIPER. And on this application, you can see your report, whatever the report you have submitted, all the report will be shown in your dashboard. And you will assign the coordinator and deputy coordinator in the dashboard. So this is a dummy copy. All the sections are same. First you insert and go back to the first you register, sign in, and after signing, you just dashboard will be open. That is ICSR reporting, ICSR list, unprocessed at institute also. And from this software, we can also approve the centers, like those hospitals and clinical establishment. They are showing the interest to participate in the Materiovigilance program. They can also submit their letter of intent or enrollment form in this software. So we can approve the center via this software only. So this software will definitely ease the reporting culture. So it will go very smoothly. You have not to fill the reporting form, and you can directly fill in this software. So all the sections are same in this software. After the report information is there, information on primary sources, organization, address is there. Next. Medical device details, device uses, device details, is the device regulated in India, UDI number, associated devices. This is the frequency of occurrence of similar adverse event, event description, and event outcome. Patient information details, age, weight, gender, medical history of the patient, or any past drug history of the patient. Then it will go to the test and procedure. If test and procedures is applicable to your case, you can also upload the details of the test. Hospitalization related information, death related information, all the sections is same as the MD reporting form. Causality assessment section is there. After that comes the manufacturer authorized representative, action and outcome taken. So while you submit all the details in the ADRMS software, you, then it is generated the PDF. This PDF is generated after you submit your report, and you just select the save option at the end. Then your whole report will be saved, and you can also delegate this report to the IPC. And it is also keep as a record for your center also, that this report you have submitted. So once a report is comes to IPC, what IPC does, first first we are having a team. IPC team is there. They analyze all the reports, and preliminary examination is done by MVPI team. What are the examinations? First, we ensure the completeness of the reported cases, whether the report is complete or not, whether the required information, that is reported information, device details are there. So whether required information is there or not. If it is there, then we'll consider. If it is not there, then we'll revert to the reporter and ask. After that, we'll discuss with the subject expert. Individual subject expert we are having, like Department of Pharmacology is there, Cardiology is there, Nephrology, Urology. We are having the indigenous subject expert. We'll discuss with the individual subject expert, and they help us to obtain the causality. And after that, we discuss with the partnering organization, that is NHSRC, CDSCO, SCTMHT. We discuss all the members, experts members of the CDSCO and SCTMHT, NHSRC. They also give their opinion on the reported cases. After that, we are based on the opinion or experts comment received from the subject experts and indigenous experts. We also communicate to the CDSCO as a recommendation and safety alerts to the monitoring centers for the safety surveillance of medical devices. So this is all the whole process, how we are collecting reports from the ground, and how we are analyzing those reports at IPC level, and how we are communicating to the CDSCO for final regulatory action. So these are the two case studies. One is of orthopedic implant, second is of IVD, COVID-19 antigen rapid case. So we discuss both the cases in the next session, and this is as a take as an assignment. Krishna sir will give you the reporting form, and you just fill the report. You just fill the case study in the reporting form, and we'll discuss these cases in the next session. Okay. Thank you all for listening me. Is there any question? I would be very happy to answer. Yes, sir.
Thank you, ma'am. This session was really very useful for us. Being part of MDMC, I really appreciate it. My question is regarding the device that uses drugs, like
drug device
eluting,
combination devices.
drug eluting stent, like MDI. So where it should be reported? It should be reported through
Actually, sir, what happens? Drug and device combination is also considered as a
device.
You have to report to the Materiovigilance.
Should it be reported through the visual flow?
Yes, sir.
Should it be reported through the visual flow or only through?
No, sir. You can directly report to the Materiovigilance program.
Okay. No need to go through the visual.
No need to report. Actually, drug and device combination is also considered as a device.
Okay.
And for example, IUCD is there. Cardiac stents, as you mentioned, cardiac stents are there. You can directly report to the Materiovigilance program.
Okay. Okay. Thank you.
Yeah, I hope I clarify your doubt.
Hello.
Yes, sir.
Am I audible?
Yes, sir. Very well audible. Go ahead with your question, if any.
Yes, madam. Actually, I am from Thane, Maharashtra city, right?
Okay, sir.
There is no specific ADR monitoring centers in my city. In that case, I just want to open a ADR monitoring center with the collaborations of the government hospital. So, what would be chances to get approvals and run IPC monitoring metro vigilance program?
Sir, you see enrollment form for MVPI is there on the website. You just fill it and send to us. At IPC, there is a committee technical support group is there who decide whether to accept the registration form or reject the registration form. But chances are very less for rejection. Mostly they approve your center, but this thing takes time. I'll suggest you that uh, since you submit the reporting form till approval, it takes around 3-4 months.
Okay,
Okay.
okay.
Sir, meanwhile, you can also start reporting to the material vigilance program. Based on reporting, also we are selecting the enrollment form that will give you the weightage.
Okay.
Okay. Thank you, sir. Uh, any other questions?
Yeah. Just curious to know how many adverts reporting you actually receive from the manufacturers.
If we talk about the manufacturer, per month, we are getting the approx 200 reports.
Because my feeling is they will try to hide it.
Yeah.
No, sir, it's not like that actually. On a monthly basis, as of now, we are receiving like 700, 800 reports per month. And among 700, some 250 is coming from manufacturers and importer side. But yes, mostly MNCs are reporting.
Oh, okay.
20 companies are there. They are reporting
20
to us.
MNCs like Abbott is there, Boston Scientific is there, Medtronic is there, even Terumo and many more. So mostly MNCs are reporting to IPC. But yes, domestic manufacturers are still less in number,
Yeah.
as compared to
So
MNC.
regarding this point, so let's say a patient wants to report, but he doesn't know how to do it because he may not be that much educated. So in that case, what are the training facilities available in the system so that the patients who are actually the end user can be informed how to actually use it?
Yes, as far as layman is concerned, so we have a toll-free helpline number available at IPC. I think Nikita has showed to all of you. If not, that toll-free helpline number is 1800 003024. It's a toll-free helpline number.
But patient may not know about it. That's my
See,
point.
See, at our MDMCs, pamphlets are there. So MDMC, they are reflecting the toll-free helpline number. If any patient or his or relative has means if they are aware to any adverse event linked with the devices, then they can just call on toll-free helpline number. Our associate at IPC, they will help you filing the case.
Thank you.
Nikita, with regard to this PVPI mobile app, whether it is covering material vigilance component also only from
It is covering medical device and drugs also.
Sir, actually, this is the old app. So this majorly focus on the drug part. But yes, you can use this app also for reporting MDAE. But we encourage you report through reporting form or toll-free helpline number. And as Nikita mentioned, that we are also in the process of developing a separate app for the medical devices. So once it is available, then definitely it will be available for.
this one, the data submission form, now it was online, now in pilot mode. Now it has entered into next phase or still it is in pilot mode?
Sir, currently it is in pilot mode.
Still we are keeping it in pilot,
pilot
mode.
mode.
Okay, okay.
To update on this CDAC developed software, it is almost done at their end. So we are waiting for launching of this software. So once it will be launched, means precisely it will be launched very soon. So once it will be launched, it will be open for public use.
Yes.
One more question with regard to this, particularly medical devices only. Okay, adverse events. When it comes to pharmacovigilance, we forwarded those reports to the WHO collaborating center. It goes to Uppsala monitoring center. Right now, whether the WHO has recognized any collaborating center for medical devices adverse events reporting?
No, sir. Currently we are not.
No, no, there is no mandate.
No
Okay.
collaboration.
No international collaborating
Actually,
agency.
in WHO, they are having we are having the WHO collaborating center. IPC is having the WHO collaborating center for medical products. It covers medical device, but though we are not reporting or we are not sending reports to the WHO, we are sending reports to the CDSO.
And there is no international harmonization when it comes to adverse events, then whatever data coming from India, India is looking after its data. Other countries, similarly, they are looking for their data only.
Yes, sir. As far as I know, we are not
No.
communicating for medical devices. There is no harmonization. Yes, sir.
We at Naipar Hajipur
Yes,
have
sir.
got many instruments to test the drugs or maybe some the tissue, blood, and also many things. Whether that instruments can be report in MVPI?
Yes, sir. Yes, sir. We can.
Or otherwise, the instrument which is only used for the human purpose.
No, sir. If instrument is using for the diagnosis purpose, also we can report to the Materiovigilance.
Because at our institute level, lot many instruments, bigger instruments are there, which which may give the wrong data.
Which may cause any adverse
Or
event
maybe
to the
some
user.
other problems.
Yes, sir.
So can we report that?
Yes, sir. You can report to Materiovigilance program.
Okay.
Thank you, sir.
Hello.
Yes, sir.
Ma'am,
I have same questions. Hello.
what is the role of National Collaborating Center, that is Sri Chitra Tirunal Institute of Medical Sciences?
They are providing testing facility to us. They are also a member of partnering, like we partnering partners meeting. They are members, and we are also getting support from the like they are also helping us in the newsletters and testing facilities. So they are helping
Basically,
us.
they are extending their support as a R&D center to IPC.
Comes to the testing, what kind of testing these people are doing? Means this collaborating.
So all kind of testing, biocompatibility,
Compatibility testing,
testing is
electrical,
there,
mechanical, all kinds of
chemical
testing they are
testing
doing.
is there,
And CTIMST is registered as a notified medical device testing laboratory under CDSU.
it is registered.
And is it possible, for example, right now our students, they are doing the postgraduate, their research projects. Is it possible if we can connect those students to those testing facilities, if they can get, first-hand experience to those that center through
We
IPC?
can try. Sir, we definitely will try. If possible, then we'll definitely face.
If we can send the student, they can develop the new skill sets, at least they should know how the testing facilities work, because this is what
Definitely, sir.
that require,
We'll work on on this part, sir. We'll definitely do.
Okay.
We'll definitely do. Yes, sir.
Like pharmacovigilance, PVPI, we have the assessment.
Yes, sir.
Whatever the reports we are sending, for that we have assessment methods. But for this MVPI medical device,
Sir, we are not having that method.
in coming days, future, is it
So
there?
maybe in future it will come, but we are not currently we are not having that assessment.
So no, for that
Like
what?
causality is we are having
Okay.
for causality we are having the European guidelines. So like that is of 5 levels: related, not related, probable, possible, and unlikely.
Okay.
On that basis only we are like classifying.
Causality assessment following the
European guidelines. Internationally, we are not having any labels like drug. We are having WHO and RNGO scale.
That is what I was.
We are not having that scales for medical devices, but maybe in future it will develop and we'll use that scales.
Okay. Thank you.
Thank you.
I'm continuing with the same question. Earlier question was asked related to the international cooperation. Because in case of pharmacovigilance, we have collaboration with
Yeah.
WHO, UMC.
Yes, yes, yes.
So what happens when the reports are sent to the CDSU? Okay, or so you have said that the reports are sent to CDSU and then back to these monitoring centers.
No. We are sending as a recommendation. We are sending reports to the CDSU. CDSU will take the necessary action on that reported case, whether it is related to the product recall, whether it is related to the update in IFU. So based on the regulatory action, they'll send letter to the
So
manufacturers.
what about the signal generation? So like in case of drugs, we have signal generation on the basis of data received all over the
In
world.
drug, we can call that signal, and
Yeah.
for medical devices, we used to call like a recommendation.
Recommendation.
To CDSU.
Okay. So from PVPI end, is there from last 5 to 6 years, how many recall were done?
If you talk about the medical device, only one recall is there, product recall is there. That is also not CDSU level, that is on the local level. Actually, I just told you the story. This is a very small story of pregnancy test kit. We receive
Which
reports
kit?
from the pregnancy test kit.
Okay.
We receive report from the MDMC center, and they are purchasing the kits from the local manufacturers. that is based on their reason only. So one associate posted at the center, they used to report to us, and from the IVD kit, means pregnancy test kit, we used to report maximum, means we receive maximum report from that case, and we recommend this case fast, like we recommend this case to the CDSE for the necessary action, and they have right to the manufacturer. You should, like, you can this pregnancy case is related to the product quality issue. This is causing the false positive, false negative, or reading error. So, that is not on the CDSE level. That, like, regional level only, the manufacturer recall that product from the hospital only, the same hospital only. So,
Thank
this
you.
one is there. Total, we have sent 20 recommendations to CDSE, and we have two cases. They have updated the instruction for use document. In that section, potential adverse event section, the adverse event which we have, like I am giving you the example of cobra deformation in cardiac stent. So in that, they have not mentioned the cobra deformation. Septal occluder cases there, devices there. So we have recommend CDSU to notify the manufacturer to add this cobra deformation uh, in the section, like potential adverse event section. So they have updated the IFU. They have mentioned the cobra deformation uh, in the potential adverse event list. So this is the
So
recommendation.
most adverse events are from class A and class B only.
If we talk about generally, the ratio is like implantable devices class C and class D also, we are getting the cases. And one case study of orthopedic implant, that is also comes, we will discuss in the later slide, like next session we'll discuss. Like, we are receiving, like, actually the at the ground, if we talk about the class A, class B medical device, nurses, technicians, they are using, but they as far, like, they are not that much aware, like bandages is causing any irritation, syringes is break, so they are not duly reporting to us.
So on that basis, like in case of drugs, there is patient information leaflet. Okay, so
Leaflet.
yeah, it gives all the information like
Same.
pharmacokinetics, pharmacodynamics, and if there is any like adverse event or anything related to drug, it is updated regularly by WHO. So in case of medical devices, also it is done.
This is PIL is applicable for drugs, same for medical devices. IFU is applicable. IFU stands for instruction for use document. So it is updated. It means
So-
periodically it will update.
Is there any cases here because of this reporting of adverse event? Is there any updation in any product?
Like previously I told you, like cobra deformation, we have updated the IFU. See?
Okay.
Same.
Yeah.
IFU updation.
Thank you.
I hope I clarify all your doubts.
Yeah.
So.
Thank you.
I have one question. As you discussed, we are following the European guidelines. How we can develop Indian guidelines for casualty assessment? For casualty
Actually,
assessment.
we are not having the causality assessment guidelines at India level. So we are just following the European guidelines only.
How we can develop these guidelines at a regulatory level?
In,
There is a committee at CDSCO level. So they are responsible actually, or the pool of experts basically, they are responsible for developing the guideline. So it's not under the purview of IPC.
so maybe in future it will be available for
And
you.
I think
It is not available for medical level.
Guidelines to cities, so they can.
Actually, some students are also working on this project, like working.
It is in the cities code. They
But unofficially, some students are working on this project. But soon it will be.
Thank you, ma'am. We have questions from online mode also. Devan, hello day, has question. Material vigilance topic. can be chosen for PhD? And if yes, how to do it?
You can do PhD in medical device safety surveillance, like in which Materiovigilance also covered. You can do PhD, no issues in that.
One of our participant, Ravi KG, has raised a hand. He can ask question from unmuting mic.
Ravi, do you have any question? You can ask. No question.
No questions.
I think no questions from the participant end. Thank you for listening me. And thank you for Dr. Kalai Salvan and Dr. Satyendra Shukla and the NIPER team for giving me this opportunity. So I'm very happy. So thank you all for being a patient listener. Thank you.
Thank you so much, ma'am, for sharing your profound knowledge with us. Now, I would like to call Dr. Sameer Dingra, sir, to felicitate ma'am. Now it's time for lunch break. I'll request our guests to take their lunch and we'll gather over here at 2 o'clock. Thank you.
Online participants, next session will start from 2 o'clock, 2 p.m.